They are not the same. Hey, what's going on, guys? My name's Anthony. I'm a student physical therapist. Now more than ever, people are concerned about their health and they want to do what's best for them. Unfortunately, there's a lot of misinformation out there. So today I'm going to tell you the difference between the flu and COVID-19. To start, I gathered all this information from the CDC, otherwise known as the Centers for Disease Control and Prevention. If you guys are interested in looking at that information, I dropped the link in the description down below. We're just going to start by saying that the flu and COVID-19, they are both contagious respiratory illnesses. Now, COVID-19 is caused by a coronavirus first identified in 2019 and then all the variants associated with it, as opposed to the flu is caused by influenza viruses. Let's talk about exposure and infection. So with both of these respiratory illnesses, it takes 1 or more days from the time that the individual was exposed until they start showing symptoms. With the flu, it takes 1 to 4 days for the onset of symptoms, as opposed to COVID-19 takes 2 to 14 days for the onset of symptoms, with at least one symptom being displayed by day 5. How long are you contagious once you have the virus? Well, with the flu, people are contagious for up to 7 days, with them being the most contagious for the first 3 to 4 days. And with COVID-19, we're still living in an unknown. We aren't too sure. We know that at least for the first 20 days, you can be contagious, but they expect that most people are only contagious for the first 10 days. That's why over the past 2 years, the CDC has gone back and forth on this, whether people are contagious for the first 14 to 21 days early on. And then towards the latter end of the second wave, they were saying people are only contagious for 10 to 14 days. And now they rolled out the guidelines that people are contagious 5 to 10 days. So if you have to give a rough estimate, just keep in mind 10 days. 10 days is on average how long people are contagious once they have COVID-19. How does it spread? Well, they're both spread actually very similar. So COVID and the flu are both spread when people are in close contact with each other, on estimate about 6 feet. And I'm going to give you a quick anatomy lesson here. So there's something called a droplet infection and something called an airborne infection. Now, both the flu and COVID-19 have been identified as droplet infections. What droplet infections are is a virus particle that's expelled when you cough, sneeze, talk, breathe, and it's put out into the air. Now, the larger particles, which are classified as droplet, stay in the air for a short period of time and then fall to the ground, and they are still active. They're still virus that can be spread. As opposed to a airborne virus is smaller particles that are expelled when you cough, sneeze, talk, breathe, and they are suspended in the air for a long period of time. And there are some that fall to the ground that are still active when they're on the ground. Now, the flu has been identified as a droplet virus, and only a droplet virus, which means that those particles, those virus particles, are expelled and they're in the air for a short period of time and then they fall to the ground, but they're still active. COVID-19 has been identified as a droplet virus and now an airborne virus as well. Early on, it was thought to be that COVID was just a droplet virus, but now it's known that COVID is also an airborne virus. So there's large and small particles with COVID that are expelled, and then some fall to the ground, they're active, some stay in the air, and they're still active in the air for a long duration of time. That's why it is so vital that individuals wear masks when they go out and about. Those masks help protect you from inhaling those viral particles into your respiratory tracts. Now, something to keep in mind. With a droplet virus, such as the flu, typically it's spread among immediate expiration, so sneeze, cough, talk, breathe, for the first 3 to 6 feet in contact you are with someone. Now, COVID-19 is the same way, but there's something that follows it. They're spread for the first 3 to 6 feet if you're in that distance from the individual, but if that individual sneezes and you walk by, let's say a minute later, you might still contract that virus if you don't have a face covering, because those particles are suspended in the air, so they're still airborne. So that's a big distinguishment between COVID-19 and the flu. The flu is a droplet virus. COVID-19 is a droplet/airborne virus. I should mention that those surfaces that are contaminated, if you touch those and then touch your face, such as your mouth, nose, eyes, you can still contract that virus, especially because these viruses are spread through mucous membranes. So mucous membranes are in your mouth, your nose, and your eyes, and those have access to get down to your lungs and your respiratory tract, and those are where viruses thrive. So that's why it's even more important with both of these viruses to wear a mask and to wash your hands. Now we get to talk about the fun stuff. There's something called an R naught. An R naught is how contagious that virus is. How many people are infected from a single individual. So the flu, on average, has an R naught of 1.3. What that means is for one single person that currently has the virus, they'll infect on average 1.3 people. So 1 to 2 people. COVID-19, there is still so much research being done on this, especially with the different variants. Early on, it was thought that COVID had an R naught of 2 to 3, which means that for one person who's sick with the virus, they will pass it on or infect 2 to 3 people. As we've came to see this past year with the arising Delta and now Omicron, which is thriving across the world, especially in the US, we're seeing that R naught is estimated to be a lot higher. On average, through all variants, an R naught of 6, meaning for every one person that's sick, they can infect up to 6 people. Now, Omicron, they're thinking, might have an R naught of 10, which is very, very high. Again, for one person that's sick, they can infect then 10 people, which is absolutely insane. This part is probably why many of you clicked into the video, is to find out the symptoms of the flu and COVID-19. And because there's so many of them, I actually have a chart pulled up here to read them off to you guys. So I'm going to start with the similarities of the flu and the COVID-19 that they both can have, they both can possess. So both the flu and COVID-19, people can present with fever, fatigue, cough, sore throat, headaches, runny nose, shortness of breath, body aches, diarrhea, and or vomiting. Now, something unique about COVID-19, which these symptoms are mostly displayed with COVID-19, is that individuals can have partial or full loss of taste and smell, red and or swollen eyes, and skin rashes. Now, these are all variable. Individuals don't have to have all of these symptoms to be classified as someone who has COVID-19 or the flu. Some individuals only possess one symptom, which could be as simple as a headache, which is huge right now with Omicron because people are only experiencing a headache and maybe some sinus irritation, which they're then not realizing they have Omicron, and then it's being spread so easily from that. So again, all of these symptoms are variable, and this might not include some that people are experiencing because it does present differently in all individuals. With the flu and COVID-19, some complications can occur during infection or after infection, and I'm going to go through some of those. It's not all of them because there are a lot. Over the past 2 years, we have seen a lot of complications in people. I'm just going to go through some of them, the ones that are more pertinent. To start, people can experience pneumonia, they can experience respiratory failure, acute respiratory distress syndrome, which is fluid in the lungs, cardiac injury such as heart attack or stroke, inflammation of the heart, brain, or muscle tissue, or they can experience secondary bacterial infections. Now, with the flu, it's more likely the individual will experience a bacterial infection either during or following infection. With COVID-19, they've seen myocarditis is very prevalent, which is inflammation of the heart muscle. With both, pneumonia is prevalent, especially being they're both respiratory issues. How do we treat them? Let's start by talking about the flu. Typically, individuals who are diagnosed with influenza or the flu, they're issued antiviral medication, and usually the sooner the better. COVID-19. We've been living in a gray area these past 2 years. We still don't know a lot about this virus. Now, the FDA approved emergency use authorization for remdesivir, which is a drug shown to help those who are diagnosed with COVID-19. There's something you can do for both of these viruses, though. Sleep. Get a lot of sleep and rest. Water and electrolytes. Intake a lot of water and electrolytes when you are diagnosed with either the flu or COVID-19. Vitamin D, vitamin C, and zinc. The combination of taking those 3 supplements have shown to boost immunity and help your immune system fight these 2 viruses off. In addition, decreasing stress, decreasing anxiety, managing your other comorbidities or co-diseases, such if you have diabetes, heart disease, asthma, making sure those are under control or at least well taken care of while you're battling these 2 viral infections, that's also very pertinent. If you're having trouble breathing, calling your family physician, or if you can get in to see your family physician, even if it's a car visit, meaning that one of the nurses or doctors is coming out to your car to see you, then prescribing you an inhaler such as albuterol to open up your airways, because these are respiratory infections. Albuterol is a typical inhaler that people who have asthma use. It's called a bronchodilator. So when they feel constricted and they feel they're having trouble breathing, it therefore opens up their airway, allowing more air to come in and more air to go out. Those are just some treatment methods that you can do if you have either the flu or COVID-19. Prevention. How do I prevent myself from getting either the flu or COVID-19? Well, there's a few things you can do. First and foremost, mask up. If you're going out and about, wear a mask. In particular, an N95 if you have access to them, because they're the most protective. But if you don't worry about that. Wear any mask because it's better than none. Second, wash your hands. If you're going out and about, or even in your own house, wash your hands because we come in contact with different bacteria and viruses on a daily basis. Third, limit your social interactions. Limiting your social interactions outside of those who you live with or come in contact with a daily basis, that decreases the likelihood of you getting sick substantially. If you do want to see people that you're not usually seeing on a daily basis, wear a mask or either see them outside where it's a lot less likely to spread a virus. Fourth, we have vaccines that are huge in preventing this thing. The flu has had a vaccine every year for a while now called the flu shot. COVID has 3 vaccines here in the US. We have Moderna, which is a 2-dose vaccine that you get each dose 4 weeks apart. We have Pfizer, which is a 2-dose vaccine that you get each dose 3 weeks apart. And we have Johnson & Johnson, which is a 1-dose vaccine. Now, there's been some misinterpretation and misinformation on the vaccines. People think the vaccines are foolproof. They were never intended to be foolproof. They do not fully guarantee that you will not get COVID-19. They help decrease the likelihood of you getting COVID-19, or if you do end up getting COVID-19, they help decrease the severity of the illness. That's the same with the flu. The flu shot isn't a foolproof that you're not going to get the flu if you come into contact with influenza. It helps decrease the likelihood that you'll get the flu or prevent the severity of the illness if you do end up contracting the flu. So if you can, do your part, get vaccinated, wear a mask, wash your hands, and limit social interactions. Side note, at the time of recording this video, 320 million people have been recorded to have contracted COVID-19 in the world, myself being one of them. 5.5 million people have lost their lives to this virus. This thing is real. This thing is here. We need to do our part. We need to mask up and take all the protection that we can. We've lost a lot, and we can't get them back, and we don't need to lose anymore. So do your part. Wear a mask, wash your hands, do what you have to do to stay safe, to protect yourself, and to protect those around you. Last semester in school, an infectious disease doctor came to talk to our class, and she quoted one of her college professors who said, "Viruses and bacteria were here long before we were, and they're going to be here long after we are." I just wanted to leave that with you guys to think about. Thank you for watching the video. I appreciate all the support. The channel is still continuing to grow. If there's anything you want to see, go ahead and drop a comment down below and I'll make a video on it. If you can, like the video and subscribe to the channel. I wish you guys health and I wish you success. Thank you again. I'll see you guys next time.